Welcome to the Endo Belly Girl podcast. I'm your host, Alyssa Chavez. I'm a nutritional therapy practitioner and restorative wellness practitioner on a mission to change the way that we support women with endometriosis. Endo is a full-body disease that impacts your mind, body, and spirit in countless ways that aren't often addressed the way that women truly deserve. We are here to talk about all of it. Please keep in mind that the content of this show has been created for educational purposes only and should never be used as a replacement for medical diagnosis or treatment. Hey, my friend, and welcome back to the Endo Belly Girl podcast. It is a guest speaker day, and I am very excited to introduce Dr. Sarah Wilson. Dr. Sarah Wilson is a naturopathic doctor, and she has so much information to share because she has such an incredible background and kind of a blend of all kinds of different things coming into her naturopathic practice, which I think is really incredible. And I will let her tell you more about that in a little bit. But Sarah is the founder of Advanced Women's Health, which is a series of clinics across Canada, including in Ontario and British Columbia. Sarah has also overcome her own health challenges, including endometriosis. I'll let her tell the story about that as well. And she is just a wealth of information. She talks a lot about the connection between endometriosis and the immune system. And that was really what caught my attention and made me want to have her on the show and chat with her about it, because that's something that I am super passionate about as well. It's something that I think endo warriors really need to know and be aware of, because it really kind of changes the approach that we take, the whole thought process behind how we're approaching endometriosis. So I can't wait to introduce Dr. Sarah Wilson to you. She's amazing. She has so much to share, and I will let her take it away. All right. Well, hi, Sarah. Thank you so much for being on the show today. I really love everything that you have to share, and I know you have so much wonderful information to share with everybody today. So thank you for being here.
Thank you so much for having me. We were talking before we got on here. We're both so excited just to nerd out and spread the information about what is actually going on in the underpinnings of a condition, but also how to navigate forward. So yeah, I'm very excited.
Yeah, I love that we can nerd out on this stuff together. That's that makes my day over here.
Exactly.
All right. Well, before we dig into all the super fun stuff to nerd out on, I would love if you can just share with us a little bit about yourself and your story and your journey and how you came to be doing what you're doing today.
Absolutely. So my journey is a long one, so I will make it nice and short and sweet. But essentially, I was diagnosed with celiac disease when I was 18 years old. And up until that point, I was in and out of the hospital, and really, I didn't present typically. So instead of struggling to hold weight and being malnourished, I was actually obese. And I was healthy, exercised, ate perfectly, did all the things. No one could really figure out what was going on. And then, as we'll talk about today, the immune system piece really came to a forefront. I had mono and I was out for 3 months. I slept like 20 hours a day. And in the process of figuring that out and recovering from that, I went off birth control pill and then I lost my period. And so when I was 21, I was told, like, you're not going to get pregnant on your own. We don't exactly know what's going on. That was the theme of my life. We don't know what's going on. But when you want, if or when you want to get pregnant, go to an OB-GYN. They will give you medication and hopefully that works for you. And until then, good luck. And so at that point, I was in research. And so I really started to apply my knowledge of hormones and inflammation, because I was studying immunology and the hormonal component of weight regulation and obesity. And I started to navigate what's going on with the immune system, what's going on with hormones, how does it connect? And in my research, I kept getting handed natural health compounds. So they would give me ginseng and mulberry and omega-3s. And I was like, give me something interesting. And they kept giving me natural health products. And so as I was doing research, I started to apply that to myself. I started to get better and decided that I was going to go into naturopathic medicine because that's how I wanted to practice. And I wanted the world to know how effective these things were. And so as we navigate forward, fast forward, I got my period back. It was insanely painful. I was passing out at certain points. And when I did get pregnant, so I have two babies now, I got pregnant quite quickly and I had a 10 centimeter endometrioma. And so that started the whole process of really deeply knowing at that point what was going on and being able to piece together hormones in the immune system and apply that to my practice. So that's where we are now.
Nice. Love that. Yeah, we were talking before this about just how powerful it is to be able to apply your own personal experience into your work with people and be able to, really have that compassion and empathy for what they're going through because you've experienced that. So you have a nice blend of, you've got the research background, which I think is really cool, and and naturopathic doctor, and you actually have personal experience. So it's kind of the trifecta in there, and I think that's wonderful because the world certainly needs more of that. So you've hinted a little bit already about the connection between endometriosis and the immune system, and this is something that I personally find super fascinating as well. I remember when I first heard this, I was like, what in the world does my immune system have to do with endometriosis? Because my major concern is period pain, at least at the time when I was first starting this journey. And so otherwise, I felt like I was generally pretty healthy. I didn't, have a lot of what looked like immune issues necessarily. Yeah. And so I would love if you can just enlighten us a little bit on that. What does endometriosis have to do with the immune system? What is the connection
Absolutely. There? And so I'm going to start the conversation with essentially, which is a hotly controversial statement, that endometriosis is an immune condition that's affected by hormones. It's not actually a hormonal condition. In the research, we are finding this condition in infants. We are finding it in men. It still has a dramatic impact on someone's health and quality of life in menopause. And so we are now really starting to look at it as an immune condition. And so what does that even mean? And what is the immune system? I always like to go there first, right? Because people are like, immune system, like, are you talking about getting a cold? So the immune system is essentially the body's defense mechanism. Its whole intention is to identify what is there in your body. Should it be there? Should it not? Is this a self cell that is healthy? Is this a non-self cell that is not? Right? This is what we're looking at. And so our immune system should identify bacteria and viruses and eliminate them. Our immune system should identify tissue that shouldn't be there and eliminate it. And it should leave healthy tissue alone. And so that foundation is really important to understand, because if you think of in endometriosis, we have cells that are kind of like, but not perfectly like, the endometrial lining of your uterus, right? They're endometrial-like tissue in places it shouldn't be. And it not only evades the immune system, meaning that the immune system looks at it and says, oh, you're normal, you should be here. But we actually start to see it creates its own micro local environment of inflammation that is separate from the rest of the body. And so in that case, what happens is the immune system then starts to defend endometrial tissue. It starts to defend endometriomas. And so it's working against us as opposed to working for us. And then we start to see different signs and symptoms, which we're going to be getting into throughout the course of the day. But it's not typical inflammation like we think of it. It's a whole different world of how your body is essentially not only letting something grow, but creating an environment for it to thrive.
Hey, my friend, if you are loving this information, I hope that you will join me for my upcoming live webinar, Thrive with Endo, Unlocking the Power of Functional Nutrition, on Thursday, August 15th. In this webinar, I will teach you how to break free from pain, fatigue, and even digestive distress using food, lifestyle, and a root cause approach through functional nutrition. This process has been a game changer for myself and so many of my clients, and I know it can be a game changer for you as well. That's happening on Thursday, August 15th, so be sure to register today to save your seat. You can register at www.endobellygirl.com/live, Live, and you can also find this link in the show notes. I can't wait to see you in there. Yeah. I find that to be so interesting. I remember, like I said, when I first was hearing about this, that there was a connection at all between endometriosis and the immune system. And it seems to be coming up more and more. It was something I think when I first heard about it, I feel like not really many people were talking about it. It wasn't very commonly known. And I feel like it's kind of getting out there more, which I think is great because for so many years, endo has been kind of this bizarre anomaly that nobody really knew where it came from or why it happened. And so I think it's beautiful that we're starting to kind of find some answers on that, because the more that we understand about how it's able to develop and grow in our bodies, the more that we're able to then support it from a foundational level and be able to really get to a place of actually feeling better and actually getting to healing the body so that you don't continue to have issues for many years to come. Because like you said, the fact that it's still coming up for people in menopause, because I know that was one of my first experiences. A doctor told me like, oh, well, it won't be an issue once you go through menopause.
Get pregnant.
I was like, great. Because I'm
like,
or get pregnant. Yeah.
Well, we can't.
Like, well, getting pregnant isn't really a great solution for everybody, but and also is a struggle for many people. Absolutely. So there's that too. Yeah. So you're talking about there is some dysfunction basically happening in the immune system. So I'd love to kind of continue to paint this picture and follow this journey of how this happens. But can you give us just some signs or like things that you as an ND would be looking for as far as, thinking that immune system might be out of whack a little bit? What does that look like?
Absolutely. And so what's really important, again, to contextualize here is that so many of the things I'm about to tell you are so common that they're viewed as normal, even though they're not normal. They're not part of a healthy menstrual cycle, right? But we view them as so incredibly common that it's just like, oh, well, everyone has PMS. Everyone has period cramps, right? So first and foremost, I want everyone to think about the last time that you had a really bad cold, right? So a virus. The day before you get the fever, how do you feel? Right? You feel tired, lethargic, you feel moody, you feel achy, right? You do not feel like yourself, and something's happening. So that is the signs of your immune system at work. That is the sign of your immune system starting to identify something that it needs to deal with, and it's creating what we call inflammation, right? So inflammation is just a sexy word for what the immune system is doing to try to deal with an issue. Okay, it creates inflammation. Now, with endometriosis, that inflammation is there all the time because the tissue is there all the time. And this is if you haven't treated it. I would like to caveat that with I was in chronic pain for years. I now have pain-free periods that I don't have to take out. So I don't want people to think just because this has been their situation since they got their period that it's their destiny, because there's a huge difference between those two things. And it's so important to acknowledge that. But that's what happens when your immune system is creating what we call inflammation. So then as we move through a menstrual cycle, and this is a menstrual cycle off hormonal birth control or other forms of hormonal modifying agents, it's really important we know that. Estrogen is very pro-growth, okay? Estrogen can be, when it's high, pro-inflammatory, meaning it causes more inflammation, okay? And progesterone is very calming. So we have this estrogen impact, okay, that comes up right around ovulation, that contributes to ovulation. This is why you can have so much ovulatory pain. This is why women can get ovulatory migraines. That's inflammatory, fatigue, brain fog, cramping, joint pain, mood changes. That's all inflammation and estrogen dancing at ovulation. In the second half of our cycle, what we call the luteal phase between ovulation and when you have your period, that you should have this balance between progesterone and estrogen. Progesterone, the calming hormone, anti-inflammatory hormone. We love some progesterone. What we see happen, specifically in endometriosis, is that our body doesn't respond to progesterone the way it should because of the inflammation. So then what we get is what I lovingly call a loop of dysfunction. Okay, so what I mean by that is you have inflammation due to the fact that you have endometrial cells in places they shouldn't be, due to the fact that we'll get into this, the bacteria in your gut are dysfunctional, they're not in the right proportions, due to the fact that you got a virus. We saw, for example, symptoms of endometriosis are 4 to 5 times worse after someone has had the most recent virus that ripped through the world. So we do know that there's a very strong connection there. And then, so they have this inflammation. It means that they can't respond properly to their anti-inflammatory hormone. And so they get more inflammation. And then right before your period, that week before your period, you start to see those symptoms come up. Body pain again. That's where we can have headaches. The most common symptoms, I would say, joint pain, brain fog, fatigue, mood changes, headaches, digestive issues, feeling bloated, gassy, bowel changes. All of those things are directly telling us you have an inflammatory event in your body. Those events are not directly associated with the hormones. People will be like, oh, I'm estrogen dominant. That's why I have those symptoms. No, it's actually the immune system that is contributing to those things. Yeah. Allergies, worsening allergies. We hear that all the time too. People will be like, I get a cold every month before I get my period, or I have allergy symptoms, congestion, things like that. Every month I get hives every month before my period. Those are all signs of inflammation as well.
Yeah. Yeah. And thank you for speaking to the hormone piece of it too, because I know that that's something, again, that I hear a lot about and was my initial understanding of endometriosis as well, was that it's estrogen fed. And I think that that's where the whole idea behind these hormone blocking meds comes in, because we're taught that, it's all about the estrogen. And I think it's so important to know. And one thing that I talk about a lot is just the fact that hormone imbalance in general is not really a root cause of anything. It's a symptom of what's going on deeper in your body. So
exactly.
Thank you for speaking to that.
It's such an important thing, I think, because the reality is that these progestin medications, right? So there's a variety of them. Visan, when we look at Lupron, these in hormonal blocking agents, they do work to some degree. They can support symptoms, but they are not. I always say there's a huge difference, right, between cutting some branches off of a tree and taking out the roots. Right? If you cut some branches off of a tree, it can look cuter for a little while. They're going to grow back, right? Those medications aren't even cutting down the tree and leaving the roots, right? That's what certain types of surgery do, right? They cut off the tree, they leave the roots, and it regrows. But those medications are literally just like taking a couple of the gnarly looking branches off and being like, yeah, it'll be okay. It just looks a little bit better, but it's not actually solving anything. And that's what I really love to empower patients to do, is while you're on those medications, if you do choose to go in that route, let's work on your immune system. Let's work on your gut. Let's work on viruses. Let's work on those allergic patterns in the body, which we can do naturally, we can do pharmaceutically, right? There's a lot of different ways to go about doing that, but we can do that while the hormones are tame and stable, so that we can break you out of that cycle, so that you don't feel dependent on that for the rest of your life. So it's not that they're never warranted and that hormones have nothing to do with it. I don't want anyone to leave this conversation feeling that. But I also, for everyone who has had multiple rounds of hormonal suppressive therapies, multiple surgeries, and you're sitting there feeling like you are alone, that you're the only person who has to be on this forever, that there must be something wrong with you, which I hear all the time, right? I am not meant to be pain-free. I'm not meant to be healthy. This is never going to happen for me. If you haven't had someone look at your immune system, then there's still, well, there's always hope, right? But it's just really important to know that there's a whole different ocean, right? Like that you can work within in terms of treatments and assessments.
Yeah, totally. And we'll definitely dig into that too. We're going to turn the conversation to that in a little bit, but I would love to, before we dig into the kind of how to support all of this, because I'm sure that will be the burning question everybody's left with. I would love if you can also touch base a little bit about that connection between fertility and the immune system.
Yeah, absolutely. So fertility, I always say, like, as much as I don't want to make light of a very serious situation, but it's a very serious situation. And so sometimes we need to think about it differently. But allowing your partner or a donor's DNA to embed into the lining of your uterus, to be given blood flow and grow and thrive is a very abnormal event. Like when you think about what's actually happening when someone gets pregnant, it is miraculous. There's no other word for it. So what has to happen? This is really, 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 really important. Is when you have implantation occurring, right? So that's the process in which essentially that little developing embryo, right? That baby that's coming on the way is getting access to nutrients and getting access to blood flow, right? From the lining of your uterus. You have to see a very significant immune shift happen. Okay. So essentially, that embedding process is a pro-inflammatory event. It's causing inflammation. And then we very quickly, like a light switch, have to then flip the immune system in the other direction to facilitate growth. So, what we see in endometriosis for a variety of reasons, and I don't know how dirty nerdy you want me to go here,
Go for it.
we see that these immune cells and the dysfunction at that level doesn't allow that to happen. Okay. Or what we can see is it's allowed to happen, but then we don't see proper what we call placentation, meaning the placenta actually can't grow and get what it needs. That can show up as miscarriage, right? Or that can show up as preeclampsia, later stage issues in pregnancy as well, which is very common. That can also show up as what we call a subchorionic hematoma, which, if anyone has been pregnant in your first trimester, that's very common with endometriosis because of the inflammation that presents. And so essentially with fertility, we spend so much time working in the fertility world on what we call egg quality, right? So getting the egg healthy, all the nutrients it needs, making sure people have enough progesterone, making sure that they have all of these, that their brain's talking to their ovaries, taking medications for that. And there's this massive void in actually understanding what needs to happen from an immune system perspective to allow that light switch to flip at the right time so that you can then carry a pregnancy forward to term with a healthy placenta. And so whenever I have someone come in to my office, or I actually own a variety of clinics and we have clinical rounds for a doctor. So I'm overseeing everyone's patients. Whenever we have a patient come in with recurrent pregnancy loss or someone who's not been pregnant ever, I had a patient, well, she's pregnant now, yay. But she tried for 5 years and she never once had a successful pregnancy, even with multiple rounds of IVF. And we again identified that she had more of a silent pattern of endometriosis, but it's still her immune system. And so no matter how great the egg quality and the sperm quality and all of that was, the immune system was not facilitating that consistent growth.
Yeah. So interesting. And again, a facet that I don't hear a lot about.
So there is a European approach to fertility work where they're now using a variety of pharmaceuticals and they're calling it this immunological protocol. There's
Mm,
very few clinics around me that are using it, but it has a lot of really promising research on supporting proper, and these are specific cell types, but we call them uterine NK cells or uterine natural killer cells, on supporting proper neutrophils, which is a type of white blood cell that we
mhm.
now actually believe to be one of the primary initiating factors in endometriomas and
Wow.
endometriosis.
Okay.
So we're seeing these huge shifts in the immune system when someone is on these medications, and it's fascinating. I think we're going to see it a lot more in North American fertility clinics in the next few years, but there is a lot of really promising research coming again to just reinforce that fundamentally pregnancy is an immunological event. It's an immune
Yeah.
system event.
So interesting. Gosh, the immune system just is so much in our bodies, right? I know
Mm-hmm.
I spent most of my life thinking your immune system was exactly what you said at the beginning. That's just me fighting a cold, right? That's all it does, right? There's a bug that comes in, my immune system fights it, done. Okay,
Yeah,
cool. But there's so many more layers to it and so many more impacts that it has on your body.
absolutely. It's we're now like coming to study in there. When I say we, it's like me and the researchers, like we're the very
Yeah.
best of friends. Like
I love that.
we we are coming to study the immune system and suggest that we can't have anxiety and depression without some kind of immune system influence, right?
Wow.
We like they're making these huge statements about how the immune system is involved in all facets of health, from mental health to digestion to joint pain to menstrual function. It's all so connected.
Yeah. So cool. So interesting. I love the research that's happening right now. It's I'm really interested to see where that goes in the future. And I hadn't even heard about the immunological work that they're doing in fertility clinics. That is really
Yeah.
interesting. I told you I was going to learn something new today, and I just did.
Yeah,
So,
it's they use essentially anti-injection or
okay.
anti-rejection medications and
Wow.
prednisone and something called intralipids or IVIG, which is essentially like giving the immune system extra support to eliminate issues. So it's eh, I I don't want to put a percentage on it because I think it would seem artificially high because patients are
Mhm.
also working with me when I refer to the fertility clinic that I work with here. But you can see really significant shifts in
Yeah.
patients who've struggled for so long. We probably have 5 twin pregnancies right now.
Nice. That's
Yeah.
amazing.
It's so, and this is just, it's just been more commonly utilized in the last year and a half here. So,
Wow. Okay. Love that. All
mhm.
right. So now I think it's time that we kind of flip the script here. And we've heard a lot about why the immune system is so important, how it can dysfunction in your body and how that really impacts so much of what endo warriors experience. But I think the really key piece that everybody's going to want to know about is how do you go about supporting that then? So when you're working with somebody or you're talking to
Mhm.
somebody about this, what are some of the things that you at least even would start to think about when it comes to supporting your immune system, from that holistic approach? What are some of the things that you would be doing?
Absolutely. I'm going to start, if it's okay, with talking about some of the assessments people might see
Yeah.
on the labs that they already have,
Yeah,
because
please
I think
do.
that becomes a big question. And that's something I look at right out the gate as I'm
Mm-hmm.
picking treatments. So there's a few markers that we hear about commonly, right? There's one called CA125 that can be tested to it's a soft marker of endometriosis. It's also an ovarian tumor marker when it's in the hundreds, but when it's elevated, that can be a sign of inflammation in the pelvis. It can also be a sign of fibroids. There was a fly for anyone who couldn't see it. Other markers that we have is things like C-reactive protein. So C-reactive protein is a marker of a certain type of inflammation that comes from our gut and that comes from our liver and can affect our cardiovascular system, but it's foundationally gut and liver based. We also have something called erythrocyte sedimentation rate, which is essentially your immune system. For any of us who are dating ourselves right now, it's like little jacks, right? So the immune system creates these little Ys or these little jacks, and they can stick to our red blood cells. So the more that sticks, the heavier it is. But also, if you think about that, the more that sticks, the more pain there can be and the more damage there can be as it moves through our blood vessels and our systems. So those markers are traditional markers we look at. But there's also a newer marker that's coming out that I find immensely helpful with my endometriosis patients. And it's called a neutrophil to lymphocyte ratio. So when you go to your doctor and they give you this panel of blood, right? And it will say complete blood count. You get it almost every time you go to the doctor for anything. They're looking at your red blood cells to see if you have enough of them, if you can carry enough oxygen. They're looking at your white blood cells in general, but they're also looking at a breakdown of the types of white blood cells. And your white blood cells are your immune system. So one of them is called a neutrophil and one of them is called a lymphocyte. And when that ratio between neutrophils to lymphocytes, so one over the other, goes higher than 2.5, the research suggests that that's associated with endometriosis, especially when combined with elevations in CA125. Like the accuracy, the diagnostic accuracy of those two tests together is immensely positive. Like it is pretty much saying if you have both of these things, then you have endometriosis. And
Wow.
so, for all of us who are really struggling to get a diagnosis to know if that's what's going on, the beautiful thing is that you can see that ratio over time. And what will happen is it can go up and down with your period, it can go up and down with your symptoms, right? I have hospitalized, like blood work from when I was hospitalized, and I can see that my ratio was like 4, 5, 7, right? And then I have my ratios when I'm healthy and they're 1 to 1. So
Wow.
that's a test that everyone has access to, that they can go log into their lab platform. And if you see that your neutrophils are consistently or cycling high and low, that is a sign that you have inflammation in your body. And everything else I'm about to say is very important to consider.
Wow. So interesting. And that I think that just that alone, the being able to just look at these simple markers on a blood test and be able to see so much information is really cool because as you know, traditionally the main way that endometriosis is diagnosed is having surgery, and that's a big
Mhm.
deal. I know it was
Yeah.
something that I kind of hesitated on because, when it was first, I in some ways, I guess one of the fortunate ones where they were able to see an endometrioma on my ovary, but of course,
Mhm.
just through an ultrasound. But even with that, it's never a for sure diagnosis. It was kind of up in
Yeah.
the air. And I was like, well, I kind of want to know for sure what's happening in my body, but also having a surgery to do that is kind of a big deal. And of course, a big
Mhm.
expense and, the recovery process. There's a lot
Yeah.
involved in that. So if it's possible to diagnose just with a blood draw, that's incredibly less invasive. That's pretty amazing.
We're getting really close. Even there's some fertility clinics in our area that are trialing what we call a micro RNA test. So it's a
Mhm.
blood test that we're using in the research to pick up little tags, right? Little indicators that endometriosis could be in the body. So we are definitely getting much closer.
Yeah.
And here, where I am, to even get on a wait list for an endometriosis surgery, you're looking at 8 months, and then you have to wait for
Wow.
the surgery. So it can be years before someone is
Yeah.
even given that opportunity. And so the faster that we can get this information and get someone in treatment, and honestly, the more that we acknowledge the incredibly valuable role of herbs and nutrients, the the better off everyone's going to be.
Yeah. Absolutely. So let's even dive into that a little bit. So, okay, let's say we did this lab work, we got it back, we see those markers, and okay, it looks like we have endometriosis going on, and looking like there's some immune stuff going on. So then what? Then what do we do actually do to help to support that?
So when I'm going through the process, what I am looking at for my patients is I am saying, okay, 60 to 80% of the immune system sits in the gut.
Mm-hmm.
This we know for sure. And there's a type of fluid. It's called the peritoneal fluid for anyone who needs to know. It's a couple tablespoons of fluid that bathes your intestines, your ovaries, your uterus. It allows everything to move smoothly over top of one another because it's all crammed in. And we see that the types of bugs that live in your gut, women with endometriosis have more inflammatory bugs in their gut and in that fluid. So, one of the first things I'm doing as a clinician is coming to understand what's going on with those bacterial populations. Now, you can run very expensive testing and see each one, but again, me and the researchers, know that in endometriosis, there's a very specific pattern in most women of these very pro-inflammatory bugs that are causing a lot of inflammation, and they are responding to specific herbs. So this is where we hear a
Mm-hmm.
lot about our berberine containing herbs, right?
Mm-hmm.
Berberine is a compound in a variety of herbs because they kill what we call gram-negative bugs. And gram-negative bacteria are what we're finding those bad bugs that are overgrowing in the system. So we first and foremost are looking at the gastrointestinal tract. And we're saying, okay, what is going on here that we need to correct? How do we need to use different antimicrobials like black cumin seed and berberine to understand that? The other big component we're looking at is what is going on with the viral immune system. As I said previously, we've seen a significant worsening of symptoms after someone gets a virus. To be honest, again, when I was sick recently, the only symptom I had was pelvic pain that was about as bad as my labor.
Wow.
Yeah, it was really severe. And then I got the sniffles.
Yeah.
But that is another symptom that we have. So we look at what's going on with viruses. Do you have a history of mono? Do you have a history of what we call cytomegalovirus? Do you have a history of a known virus that we need to work to stabilize in the body? So that's where, again, we can use herbs, but we can also use pharmaceuticals to help to create stability there. When we have that, then we can look at what we call anti-inflammatories and pain support. And the things that sit in that category is we're hearing a lot right now about curcumin. We're also hearing a lot about something called serrapeptase,
Mm-hmm.
which is breaking down these clumps of inflammation that I was talking about, those stacked jacks. It's breaking that down so that we get less pain in response to the inflammation, less pain with our periods, less pain with intercourse, less bowel changes. So we're looking at that. And then we're looking at what we need to do from a pain perspective. Because, and one of my friends here is a physiotherapist, and she focuses so much on the pain experience in endometriosis because it's such a trauma, right? You
Yeah.
feel that pain coming on, your whole body and nervous system shifts and changes because it's so terrifying that
Mm-hmm.
you could go into that degree of pain again. So we're working in that kind of fourth quadrant on the nervous system and pain and creating stability there, whether that's using, again, herbal formulas for the nervous system, or we're seeing a lot of research come out on something called PEA, which is an anti-inflammatory, and saffron, which is an anti-inflammatory and pain support. So that's really the big quadrants that we're looking at
Mm-hmm.
with respect to treatment. And then, of course, food is in the mix there too.
Of course. Gotta have food in the mix. Yeah.
Yeah.
Yeah. That connection too with the gut is something that I never knew until I started digging into this whole world that I'm in now, that there was any immune system in your gut. Like, no one told me that. When I think of immune system, I would think of like my lymph nodes that get swollen when I'm sick. I
Absolutely.
had no idea that it was connected at all. So it's something that I have really looked into a lot too. And something that I personally found really incredibly helpful, because my journey started with just doing nutrition work at first. I did a lot of dietary changes and did start to see a difference, but I wasn't quite where I wanted to be. But when I started really digging in and learning about gut health and how to support our bodies and how to bring balance into those bacteria in your gut, that really moved the needle for me a lot. And I think also I've seen a lot of research and studies and information about just the high number of people with endometriosis who also have gut symptoms of some kind or another. I've seen upwards of 90% of women with endometriosis, studies have shown that. So I always say there's no way that's a coincidence, right? If it's like,
No.
oh, there's 10% or 20%, like, okay, well, maybe that's, who knows? But when it's that high of a percentage, and and just from even my personal experience, when I have people coming to me and talking to me about their experience, just about everybody I've worked with comes to me with like they've got bloating, constipation, just food just makes them feel yucky is something I heard recently. I mean, so many different things. And so that kind of, for me, kind of puts the puzzle pieces together. Like, okay, we're talking about immune system. Your immune system lives in your gut, for a good chunk of it anyway. Like there's a lot of work that we can do there. So I think it's always very empowering to know that there's something you can do about it.
And I think it's so important to just, again, I love to go back to the anatomy conversation, and I love to go back to where things sit, right? So if you take your hand and make a fist, right? If you're listening to this and you make your other hand flat, if you touch those things together, that's your uterus is the fist and the flat is your bowels. So if we have inflammation in one, we have inflammation in another. And you're 100% right. The research shows if you have pelvic pain and IBS, there's a 90 to 95% chance you have endometriosis. It is so high. And essentially what's happening in those situations is you can have that irritation, right? This is why we get period poops. You can have that irritation of the inflammation irritating your bowels. And then your body, this is like when we get gastro, when you go on vacation, right? You get diarrhea. So what that is your immune system has recognized that there's inflammation and it's trying to rinse it out, right? It's trying to power wash your intestines and get that out. So it causes contractions and you hold more water. And then, so that happens on your period. And then outside of that, it is very common. So the space between your uterus, your vagina, and your bowels is called the pouch of Douglas.
I love that
area.
name.
I know, right? It concentrates endo will go and fall in that area. And we can get a lot of scarring, a lot of what we call adhesions or things sticking to each other. And so then you can't get proper contraction without that inflammatory event. And so then we see constipation. So that cycle between constipation and diarrhea is incredibly common. And I always say when you have those like that bowel that's not contracting and those bugs hanging out, they can grow. And so we get these patterns where we get an overgrowth of bad guys, which is also why for a lot of people, probiotics don't work because it's an overgrowth. And it's not to say they won't. And I actually used to be a probiotic researcher, fun fact. But in my experience, what's so important to keep in mind is that if you already have an overgrowth, adding more bugs can be adding fuel to the fire. So if you're told to take a probiotic for your irritable bowel syndrome or IBS and you felt worse, you are not alone. It is because there is an overgrowth. And so we actually need to go in and start to remove some of those bad bugs.
And then what's your approach? This is just me being curious as a fellow practitioner here, but I always love to hear other people's thought processes on this. What's your approach then? So, because, I absolutely agree, especially if there's overgrowth, there's oftentimes you do need to do a little eradication and kind of kill off those guys that you don't want in there because they can cause these negative symptoms in your body. But what's your approach behind, like, on the tail end of that? Okay, we've done some of that. Do you recommend for people then to support rebuilding those good gut bugs? And what's your approach behind that?
I'm smirking because I'm controversial here. So
that's okay. I like it. I love hearing different opinions.
So there's something in the body, and it's called quorum sensing. Again, nerdy term, but let's break it down. So if you have ever seen a cuttlefish or an octopus change colors, right? You know how they all change at one time. So part of how that happens is through bacteria. So the bacteria are all communicating and signaling that we should change colors. So what happens with the bugs in our system is if you have too many bad bugs, they control the conversation. Okay.
Mm-hmm.
And so they are saying it's red. Everything needs to be red. And so if you have a good level of good bugs, but too many bad bugs, the dominant conversation is still red. So as we start to kill those bad bugs and bring those down, we're giving the opportunity for those good bugs to start to control the conversation. If there's enough of those good bugs, they will control that conversation, turn it green, and the whole environment becomes anti-inflammatory and starts to defend against the bad bugs overgrowing again.
Mm.
If we don't have enough of those good bugs, that's where probiotics can be helpful because you're adding
Right.
more green to control the conversation. And so what we know in general is that those good bugs need a lot of things to grow, right? They need blood flow, which the stress response has a huge impact on that,
Yeah.
right? They need enough fiber that they can grow on. They need an anti-inflammatory environment and they need friends. So this is where when we get into repair phases and people are adding in probiotics, they're adding in different fibers, they're adding in that, it can help, but we have to kind of know where the conversation is sitting at. And we also then have to make sure, especially in endo, because there can be so many challenges with that contraction and moving those bugs through with constipation, etc., that those good bugs don't overgrow. So it's a bit of a dance, but the mass majority of the time when you're working on the immune system in general, viruses, food, etc., you're working on the bugs and you're working on the stress response. We don't need a huge rebuild phase because you've brought those bad bugs down enough that the good bugs can regrow. The big mistake I see practitioners make is they don't bring the bad bugs down enough. They just bring them down a little bit, but they're still controlling the conversation. So even though there's less bad bugs, it's still red. It's not green yet. And so it's about knowing where that balance is, and we can use symptoms or testing to do that.
Interesting. Yeah. This is what popped into my mind as you were talking about this, and I'm not going to at all turn this into a political conversation, but it just made me think of like the red states and the blue states, like who's I'm in the US here, so that's been because we have our election coming up
they're
later this year,
shifting.
and
It's all kinds of color change.
I'm just thinking
right
about
now.
like the conversation flipping back and forth and who's controlling
100%.
the conversation. That's what popped into my brain. So I'm picturing our gut being kind of like that, like who's controlling the conversation right now.
Our gut is quite literally the microbiome or the US politics in July of 2024. So if anyone wants to go back in time and read the headlines, this is 100% the best representation of our microbiome that we could ever have. Who's stepping up? Who's stepping down? Who's here? Who's there? What's happening?
Right.
Yeah. That was perfect.
I don't think I've ever mentioned this on my podcast before, but that is what popped into my head as you were talking about that. I was like, oh, it's like our political climate right now.
Exactly. We've got to repair at some point, but we don't know what it's going to look like.
Oh, goodness. Okay. Well, I think that's a super fun note to wrap up this conversation. But I think you've shared so much wonderful insights on here today. I think that can really enlighten people, because I have a lot of people coming to me are just like, I don't even understand what's happening in my body. I don't even know where to begin. And goodness knows there's so much confusing information about there and conflicting information. You know, I'm in a lot of these, Facebook support groups, and I see some of the posts that go out of people asking things, and I'm like, wow, there's a lot of misinformation out there. So I think having conversations like this is really powerful and really important. Is there anything that you feel like we missed, anything else that you feel like you need to share today that's really important?
I think the one thing that I always love to leave on in this conversation is the fact that you don't need to know how all the pieces fit together to have the aha moment. And when it comes to the immune system, I have been at this for over a decade, right? Yeah. I spend every day in research. We see thousands of patients across the board at our clinics. So I'm taking a really big topic and trying to simplify it.
Yeah.
And if it feels like that, it's true. But what I want everyone to take out of this is if you have been trying to navigate a condition hormonally and you're being told it's hormonal and you're feeling like you're not getting the results that you're after, or you're not getting the answers you want, you're not crazy. There
Yeah.
is a big force that is the immune system that needs to be navigated, and it's nuanced and it's sophisticated, but getting into the depths of it and supporting it is also wildly effective. And as someone who supports people to get out of pain, to get pregnant, to have been the person who does, I have a 1 centimeter endometrioma now, not a 10 centimeter endometrioma.
Yeah.
I fortunately did not have surgery, right? I
Wow.
am not in chronic pain anymore. I just want people on the other side to feel hope, because I have people in my office every day that are bawling, feeling like I'm the last
Yeah.
option. I'm the last hope, that no one else has been able to help them. So why would this one other approach work?
Yeah.
And so just really do keep that hope up as hard as it can be, because there is so much research happening right now. There is so much being dedicated to how the immune system is involved and how we can work to modify it to give you back your quality of life. And so it is possible. And I really want people to hold that, even if they're listening and they're like, I don't know what she's saying, but they're frantically making notes or whatever that looks like. Just know that it's possible and there are people that can help you.
Nice. Yeah. Thank you. I think that's so important too, because that's something that I hear about a lot too. It's just like you start to feel like this is just your life sentence. It can be very disempowering. And so I think knowing that and keeping that in mind can keep that empowerment and keep that, like you said, that sense of hope of just, there is something else. There's more to the story. There's more that you can do. And I think that can help to bring people out of that just cycle of frustration and confusion and all of that. So thank you for that. I appreciate it.
Yeah. And I have practitioners trained all over North America. So
Nice.
it's one of those pieces that if anyone needs help, like I am more than happy to help them navigate as much as I can, as much as my assistants can, because I have been there and I just really want a different path for other people.
Yeah. Love that. Well, I'm sure people are going to want to find you and connect with you and learn more about what you do and how you help people. So can you share a little bit about where we can find you?
Absolutely. So I own Advanced Women's Health. So we have clinics across Canada. But as I said, I also train practitioners. I have a whole practitioner training. So I train practitioners throughout the US. So you can reach out on that. But you can find more information at advancedwomenshealth.ca/endobelly. And I can put some of those resources there. Or I'm on Instagram at DrSarah_ND.
Perfect. And I'll share that in the show notes as well. So you can look that up if you're like me and you're always listening while you're multitasking and doing other things. So you can find that information in the show notes. All right. Well, thank you so much for being here today, Sarah. I really enjoyed our conversation. I think there's so many beautiful takeaways, and I hope this is helpful for people. So thank you so much for being here today.
Thank you so much for having me. I am so supportive of anyone who's supporting our endo warriors, because we need it, and staying curious is such a huge part of it. And I love that curiosity that you have. So thank you.
All right. I'll talk to you all soon. Have a good one. Thank you so much for joining me today, my friend. If you loved what you heard, be sure to share with a friend and subscribe so that you can keep coming back for more. If you are ready to take the next step towards getting to the root cause of your endo symptoms like endobelly, pain, fatigue, and so much more, you need to download my free ultimate guide to building your own endometriosis diet. You can find the link in the show notes or at www.endobellygirl.com. Until next time, my friend.